Hi, today we'll go talk about wound healing. The basic principles. Healing is initiated when inflammation begins, occur via a combination of regeneration and repair. Regeneration is replacement of damaged tissue with native tissue, dependent on regenerative capacity of tissue. Tissue are divided into three types based on regenerative capacity: labile, stable, and permanent. Labile tissue poses stem cells that continuously cycle to regenerate the tissue. Small and large bowel stem cell in mucosal crypts, skin stem cell in basal layer, bone marrow hematopoietic stem cell, stable tissue are comprised of cells that are quiescent in GO phase of cell cycle, but can re-enter the cell cycle to regenerate tissue when necessary. Classic example is regeneration of liver by compensatory hyperplasia after partial resection. Each hepatocyte produces additional cell and then re-enters quiescence. In this page, the lymphocyte infiltration of salivary gland, also called is lymphocytic cell adenitis, uh, which we can see in Sjogren's syndrome. Sclerodactyly, scleroderma of the patient hand, and intestinal crypts. Example. Permanent tissue lacks significant regenerative potential. Uh, is the myocardium, skeletal muscle, and neurons. Repair, replacement of damaged tissue with fibrous care occur when regenerative stem cells are lost, for example, deep skin cut or when a tissue lacks regenerative capacity, healing after a myocardial infarction. Granulation tissue formation is the initial phase of repair, consists of fibroblast deposits, type 3 collagen, capillaries provide nutrient, and myofibroblast wound contracts. Eventual result in scar formation is type 3 collagen is replaced with type 1 collagen. Type 3 collagen is pliable and present in granulation tissue, embryonic tissue, uterus, and keloids. Uh, Type 1 collagen have high tensile strength and is present in skin, bone, tendon, and most organs. Collagenase removes type 3 collagen and requires synthesis cofactor. Mechanism of tissue regeneration and repair, mediated by paracrine signaling via growth factor. For example, macrophages secrete growth factor that targets fibroblasts. Interaction of growth factor with receptor is epidermal growth factor, which this growth factor receptor result in gene expression and cellular growth. Examples of mediators include tissue growth factor alpha is epicenter and fibroblast growth factor. Tissue growth factor beta is important fibroblast growth factor, also inhibits inflammation. Platelet-derived growth factors, growth factor of or endothelium, smooth muscle, and fibroblasts. Fibroblast growth factor is more important for angiogenesis, also mediated skeletal development. Vascular endothelial growth factor is important for angiogenesis. Normal and aberrant wound healing. Cutaneous healing occurs via primary and secondary intention. Primary intention wound edges are brought together. Suture of the surgical incision leads to minimal scar formation. Secondary intention edges are not approximated. Granulation tissue fills the defect, and myofibroblasts then contract the wound, forming a scar. The layer wound healing occur in infection most commonly cause of Staph aureus is the most common offender, and vitamin C, copper, and zinc deficiency. Vitamin C is important for cofactor in the hydroxylation of proline and lysine procollagen residues. Hydroxylation is necessary for eventual collagen cross-linking. Copper is a cofactor of lysyl oxygen oxidase, which cross-link lysine and hydroxylase to form stable collagen. Zinc is cofactor for collagenase, which replaces the type 3 collagen of granulation tissue with stronger type 1 collagen. Other cases include uh, other cases Other cases include foreign body ischemia, diabetes, and malnutrition. The hindrance is rupture of wounds, most commonly seen after abdominal surgery. Hypertrophic scaries exceed production of scar tissue that is localized to the wound. Keloid is excess production of scar tissue that is out of proportion to the wound, characterized by excess type 3 collagen, genetic predisposition or more common in African Americans, and classically affects the earlobes, face, and upper extremities. On this page, we can see basal layer of the skin and myocardial scarring after myocardial infarction and granulation tissue. Or in this page, we see hypertrophic scar is abundant with collagen 1 and keloid is abundant with collagen 3. Uh, Thank you. The next topic is principle of neoplasia.